We know that 1 in 5 individuals have a diagnosable mental health condition, and that's not even people who may be having a mental health challenge at the moment. And within that, our young people are having trouble getting help. There's a national shortage of child psychiatrists. There will never be enough child psychiatrists, and it takes many, many, many years to create one through training. So it's going to take a long time to solve for. There just aren't enough people going into healthcare.
Yes.
Not just physicians, but nurses, pharmacists. The healthcare ecosystem is large, and we just don't have enough people. I'm a doctor. It was one person who said, you should become a doctor. And if we all just went around and said, you should go into healthcare to one other person, we can make such a difference in people's lives.
This is Inspiring Women. I'm Lori McGraw, and today I'm speaking with Dr. Sandy Chung. And Dr. Sandy Chung is many things, but she is a national expert. She is the past president of the American Academy of Pediatrics. She is the CEO of countless organizations. Sandy, I was going through all of the different ones there. What we're going to talk about today is advocacy. We're going to talk about the calling of being a physician, but then leading into leadership and so much more. Dr. Chung, thank you for being on Inspiring Women.
Well, thank you so much for having me. It's an honor.
Well, let's get into it. So when did you decide you wanted to be a doctor?
Yeah, so I'll give you a little background. My parents immigrated to this country from China, and when they came, despite having advanced degrees, they couldn't get a job because they couldn't speak English well enough. So my mom sewed clothes in a factory, and my dad was a waiter in a restaurant. And we grew up, I was born in the United States, but we were quite poor. I lived in a trailer park. We were on Medicaid. Eventually, they saved up enough money to go and open up a Chinese restaurant. So I grew up working in a Chinese restaurant. So healthcare was not in the cards. I did not know anything about that. We had to, I remember we went to an urgent care maybe if we were sick, at the most. And so, but when I was in the 4th grade, I had to do a project on what I wanted to be when I grew up, and I didn't know. And I remember standing at the bus stop, just thinking out loud and talking about it. And the mother of one of my friends said to me, "Sandy, you should become a doctor." And I thought, okay, that sounds great. And not really knowing what that meant. But obviously, if you say you want to be a doctor, there's a lot of positive reinforcement there. And so she gave me, it turns out she was an operating room nurse, and she gave me the little hat cover that you wear in the OR and little shoe covers and a tongue depressor. She even gave me a disposable stethoscope.
So you have more than a little black bag.
Exactly. And I walked into school wearing all this stuff, and I thought it was so amazing. So that's how I decided I was going to become a doctor. Luckily, it all worked out. I was good at math and science, and ultimately really enjoyed working with children, and so became a pediatrician.
So, Dr. Chung, being a physician is a lot of work. It's many years of schooling, residency, all of the things. You did much more than that. So when you did all of that very hard work to become a physician, why was that alone not enough? You from there became an advocate. You from there started many different organizations. We'll go through some of them like Trusted Doctors and others. Yes. But what moved you from just doing something very important, taking care of children and their families, to then doing more?
Yeah, great question. I think when, in my background of working in a Chinese restaurant, I actually think had a little something to do with this. When I joined the practice, my pediatric practice that I joined, I realized I really liked the business side of healthcare. And I think growing up in that small business really informed that. So I learned about customers and managing inventory and managing finances, all of that. I didn't know it at the time. I just thought my parents were making me do things I didn't want to do. But ultimately, I learned skills and really gravitated towards that. So I got my master's in health administration while I was at school, working at the practice, became managing partner fairly quickly. Then over decades grew my practice and was seeing issues in front of my patients, in front of our practice, all these things that were happening. And when I realized that, things can be different, need to be different, I started to look for ways to find solutions and found my way to organized medicine and, first my local Northern Virginia Medical Society, and then eventually our state medical society, and then the state chapter of the pediatrics group, so the AAP there. And so through this, I started to learn more and more about how you can make change, and not just in your practice setting, but in other settings, and how powerful organized medicine can be.
Yeah.
And so that was really how that began. And I remember going for the very first time, very young, not knowing anything. I just thought it was a club that I was supposed to join because I was a doctor.
It's just a professional sort of like networking kind of group.
That's
not
right.
at all.
Not at all. And I got there and I realized there was nobody there that looked like me. It was largely a male-dominated group that I initially went to. But I remember this, it was a pediatrician, a wonderful man, who said to me, "So Sandy, what do you care about?" And at that point, I was like, "What do you mean?" I don't know.
Children.
Yeah, exactly. I care
Being
about
a physician.
my work. I graduated. I have a lot of debt. All these things. That's what I care about. But he meant it in terms of advocacy.
Yeah.
And that really made me think. Like, what do I care about? And as I continued through my career, it became different things.
Yeah.
And so a lot of the things I did in my career are based on all those different things I encountered.
Some of those things, just to name a few of them. I mean, so you. Physicians having independent practices has been a signature issue for you.
Yes.
And so we all know with the million practicing physicians that are out there, during my time at the American Medical Association, it was when we crossed the chasm from the 50% mark of physicians no longer being independent practices to being in, owned practices or part of payer groups and the like. You have been very focused on keeping pediatric physician practices as independent. Why is that so important?
Yeah, I think that there's a room for all of this, right? I do think that I'm not a person who will say, "Oh, this is the only way." I think it's important that there are all different types of practices because there are all different types of patients, and you just need to have that opportunity for everyone. However, in independent practice, I think there are physicians who are entrepreneurs, similar to myself, who need a place to work, and that's hard to do when you're in an employed setting. Not impossible, but hard to do. Also, I think that when you're independent,
hard to do because of financial pressures, because of
bureaucracy,
even though you
Yes.
learned your business skills in Chinese restaurants growing up in that way, most physicians don't have those business skills. But you have to be a business owner, a CEO, to successfully run an independent practice.
That's right. Every medical practice is a small business to start with, and then we deliver services. And so then how do you do that in a way that you can stay viable as an entity? And so as I think about independent practice, where we can pivot much faster, we can also be in communities where sometimes other people don't want to be.
Right.
So independent practices often are people who came from those communities, and they go back and hang up a shingle, if you will, and then start their practice. But with the way that our healthcare landscape is currently formulated, it is very, very hard to stay independent and stay viable financially. So, yes.
So you've done that. Another issue that you've spent a considerable amount of time, effort, and starting organizations is in mental health and really advocating and delivering care in a more accessible way for children. I think we all know in this world how mental health issues, they have only become exasperated, and many younger people and children are dealing with mental health issues in a way that is unprecedented. So can you just talk about what those issues are, maybe by the numbers a little bit, but then what have you specifically done to provide more access to resources for children?
Yeah, so we know that 1 in 5 individuals have a diagnosable mental health condition, and that's not even people who may be having a mental health challenge at the moment. And within that, our young people are having trouble getting help. And this was in 2017, I had a 14-year-old young man who had bipolar disorder, and we were his pediatrician, and his child psychiatrist had retired. There's a national shortage of child psychiatrists. There will never be enough child psychiatrists. service, and it takes many, many, many years to create one through training. So it's going to take a long time to solve for. But at the same time, when going through pediatric training, I was taught to refer. If I saw a patient who needed help, refer them to the psychiatrist and therapist. But because there's a shortage, the waiting list has gotten to be 6 months long in many, many places. So the child's family called. They got another appointment. Their child psychiatrist had retired. They got another appointment, but it was 4 to 6 months later. And they wanted us to refill his medications. Well, he had some very complicated issues, and it was on 5 different medicines. They weren't things that pediatricians prescribe. And also at the time, Medicaid wouldn't pay for it unless a psychiatrist prescribed them. So we said, okay, we can't refill these, but what we can do is get you an appointment. So we called and called and called. We got him an appointment 4 weeks later, and we thought we were in a good place. Unfortunately, during that time, he ran out of his medicines, and he had an exacerbation of his disease. And when he did, he got into a fight in the parking lot near my office. And during that fight, he had a gun, and he shot and he killed somebody. So that 14-year-old ended up in juvenile justice. That other man lost his life. And to me, there's so many ways that could have been prevented.
And it's such a failure of so many systems.
So many systems. And to me personally, I obviously knew this family, so how can we change it? How can we do this differently? And so I learned about these programs called Child Psychiatry Consult Lines that were in other places. So I'm in Virginia. Washington, D.C. had a program. North Carolina had the starts of a program. But Virginia didn't have one. So I went around and started advocating for something different. And what we needed something where the primary care clinicians would be trained so we could learn how to do this. Like, we didn't know how because we were taught to refer. So teach us how. We manage all sorts of medical conditions. We can do some of this. Then I'm not a psychiatrist, so at some point I get to the point where I need some assistance as the clinician. If a child has a heart condition, I can call a cardiologist right away.
Yep.
They'll get on the phone. They'll tell me what to do. They may even see the patient. That doesn't happen in mental health. There's not a resource for that. So we needed a place where someone could pick up the phone, a clinician could call and say, I have a child with bipolar disorder on these medicines. What do I need to do? How do I take care of this person? And at the same time, the family needed help. How did we get them to an appointment faster? How do we help them find somebody?
It's not just an individual patient for all the people that you're taking care of. It's the entire family who's impacted.
That's right. So basically we created a program called the Virginia Mental Health Access Program, or VMAP, and that covers all of those things. So trains the primary care providers, gives them a consult line for a specialist to help them, and then care navigation for the families. We advocated through our legislative process, we spoke to our governor, so many resources. We went all around the state, collected resources, stakeholders. There were advocates, there were mental health providers, clinical providers, hospitals, insurance companies. Everyone came together, and they all agreed. And so then we created this program, and it got passed through the state budget. It was funded by the state. We got some federal funding for it as well. And then later, we added services for younger children, for autism, so that pediatricians could diagnose autism, get them to resources faster, because currently there's an 18-month wait list. We added maternal health, mental health, because pediatricians were also seeing the moms.
Yep.
And we're screening them, and we don't know what to do because
Yep.
they're not our patient. And so we did the same thing. And then this way, OBGYNs are trained, doulas are trained, midwives are trained, pediatricians are trained, family doctors, everyone. So now it's a $15 million program funded by the state.
Yeah.
We just did we've done 13,000 calls.
Amazing.
And just helped lots of people.
What an impactful program. And just like starting from a terrible circumstance and then determining that there was something just more that you can do with that. And Dr. Chung, like, we could go into all of the technology work that you do, and we could go into interoperability, and we could go into so many other things where you take an issue and you decide to dive in with big impactful programs in terms of how to solve them. But you have other passions. So can you just talk about sort of like what is passion of the day that you are leaning into right now?
Yeah, I love it. I think it's a little bit of, I call it, it's probably ADD, but I call it multitasking, I guess. So we'll call it that. That sounds more positive. But what I currently am focusing on, as past president of the American Academy of Pediatrics, had an opportunity to travel the country, see the state of healthcare and pediatrics especially, but really just learning about all the different things happening. And there just aren't enough people going into healthcare.
Yes.
Not just physicians, but nurses, pharmacists, insurance. The healthcare ecosystem is large, and we just don't have enough people.
And it's getting worse. And I think that people are feeling it in new ways. It used to be, 4 weeks to see a primary care physician. We're in the waiting period of months, now in many areas. And if you need a specialist, of any kind, those have become longer and longer wait times. And during those wait times, problems emerge,
Absolutely.
or become worse, or things of that nature.
That's right.
So what are you doing?
Yeah. So, my 4 kids, I have 4 kids, and so they are that
Because you had
college
time
age.
to have 4 children and have that kind of family.
Right. Why not? And they're amazing. And so I was noticing as they were going through college that a lot of their friends were thinking about healthcare, but once they started to pursue some of the more stereotypical path of I'm pre-med, and they weren't able to they found it wasn't for them, often they would leave healthcare entirely. And, when you go into college, you may not realize how many things there are available in healthcare. I mean, for me, I knew about 5 jobs, right? I was like doctor, nurse. I didn't know about pharmacy. It was like teacher, lawyer, engineer. Those were all the jobs I knew about. And so now I was thinking, well, how do we match college students to people who are doing all those other jobs in healthcare just so they can see? And maybe they're pre-law, and so that one day they may go into healthcare law. Maybe they'll become our future legislators, and they're going to remember, I did that thing, with the nonprofit I started. So I started a nonprofit. It's called Trusted Care Foundation.
Okay.
And so we're matching college students to opportunities. For example, I brought a young lady from Alabama. She was first generation college. None of her family had ever been, and I took her to a conference with me. And her eyes just lit up, and she got to meet all these amazing leaders in the healthcare space. And she was like, thank you. That was incredible. I had no idea any of this existed. And so if we each just took one college student, I mean, if you think about how I became a doctor, it was one person who said, you should become a doctor. Mm-hmm. And if we all just went around and said, you should go into healthcare to one other person, we can make such a difference in people's lives.
Well, it's such an important profession, and we have so many more people that need care in all kinds of different ways. And I have, so much experience in technology and innovation, and I'm excited about all of those things. But the people that are needed, that are skilled professionals in this area, where it is a declining resource, name the type of professional that exists. There's less of them and more people in need. Well, Dr. Chung, that is amazing. As we close out this Inspiring Women conversation, would you mind just sharing, you have had such already an impactful career, that spans time of serving patients, advocating for policy, advancing practices, technology, and now the next generation of, workers in healthcare. What is your advice for younger women in particular who are pursuing their next leadership journey? What do you advise them?
Yeah, it's a great question. I think really the key that has at least worked for me is to always be curious, never say no, and always assume it will work. So at the end of the day, it will work. It may take a while to get there. You may follow a circuitous path to get there, but in the end, it will work.
What an amazing, amazing way to end this conversation. I've been speaking with Dr. Sandy Chung, and Dr. Chung, thank you so much.
Thank you so much for having me.